everyone, thanks so much for checking out my channel Travel with a Twist, and this week we are talking about part 2 of treatment options for polycystic kidney disease. So we will go over those and then we'll talk about something I'm looking forward to after transplant and then finish up with my travel tip for the day. So like I mentioned last week, polycystic kidney disease currently has no cure, and the treatment option GnRQ that we talked about is simply a way to help slow the progression of the disease. However, once patients reach the end of the disease progression, known as end-stage renal failure, there are only two options for how to continue sustaining life, and that is one, being hooked up to a machine and using dialysis, and the second option is undergoing a kidney transplant. So I'm going to share with you a little bit about each of those options today. And I did get most of my information from Fresenius Kidney Care. I actually underwent a options course myself last month before I got listed for transplant, to just kind of go over all the different options, what everything entails, to make the best decision for me, and as well as just kind of have backup options in case I do need to proceed with dialysis or something like that. And so definitely consult any healthcare professional that you have regarding different options. And like I said, this is just kind of an overview of each of the different type of options that are available. So there are two types of dialysis. The first type is called hemodialysis, and hemo means blood, and so it's essentially filtering the blood out of your body and then putting it back in once it's clean using a machine called a dialyzer. And so in order to get hooked up to this machine, you need to have a way that the body can be connected. So there are a couple different options that are involved in that. The first option is called a fistula, and this is kind of the gold standard of most ideal options for access for the veins. So what happens is they actually go in prior to dialysis starting and do a procedure to connect a vein and an artery, either in the lower arm, or I've seen them done in the upper arm as well. And this kind of bulks up the access point and allows for connection to the dialysis machine. This option is the gold standard because it is utilizing just your natural anatomy, and it does require longer healing time of 6 to 8 weeks. So there's another option called the graft, and that is essentially the same thing, but instead of being able to connect the two together by themselves, it uses a tubing that gets inserted to connect the vein to the artery. And so this is also a good option. It is a quicker healing time of 2 to 3 weeks, but it does, insert something that's foreign into your arm, so it can cause a little higher risk for infection and things like that, but is an option for quicker access if a patient is needing dialysis at a sooner time. The most fast option to gain access for dialysis is known as a catheter, and so they either put those in the chest here, in the neck, or in the groin, and this is another tubing that goes in via procedure. This allows for immediate access to the veins to hook up to a dialysis machine. However, it does carry the highest risk because it has to stay dry. It's in kind of like an open area, so it does have potential for the most infection rates. So it's not ideal, but it is for immediate access, and it can also be used for an alternative if the fistula or the graft needs healing time in order to transfer over to that option. So hemodialysis is essentially whatever access point is put in the patient is then connected to the dialyzer machine. And this is a machine that will then remove the blood from the body. It filters it in the machine, and then it returns the blood back to the body. So with hemodialysis, there is an at-center option, and then there's also an at-home option for allowing a little more flexibility and independence. Both options do require patients to have 3 to 5 days of treatment, and usually the treatment time is 3 to 5 hours per session. So the at-home option is kind of nice and more convenient because the patient won't have to travel to the center each time. There is a training period where the patient will learn how to utilize this option for dialysis, how to do their sessions, how to perform everything they need to perform. It does actually allow for a little flexibility with timing as well. They can actually extend their session days and do 5 to 6 days for shorter session times of 2.5 to 3 hours instead, kind of based upon the amount of dialysis needed. So that allows for a little more flexibility and independence. The in-center option is nice and convenient as far as not having to do a lot of hands-on treatment. You essentially go to the center, the nurses and the techs there will set the patient up, will perform the dialysis, and then send them on their way. So the downside with that is that they just have to go to and from the center and stay there for multiple hours per session. The second option for dialysis is known as peritoneal dialysis, and peritoneal dialysis utilizes the peritoneum cavity within the abdomen. And so this cavity is what holds all of the organs, and essentially the procedure for this prior to dialysis is inserting a catheter or a tubing into the abdomen of the patient, into this cavity where this space is with all the organs, and there's tubing inside that remains in there, and then there's tubing that will be on the outside that will connect to the dialysis machine. And so this option of peritoneal dialysis allows for the most flexibility and independence. It is able to be done at home. It's also, there's a couple different options for this. There is a nighttime option for peritoneal dialysis where the patient can essentially hook up to the machine, have it do its thing throughout the whole night while the patient's sleeping, and then unhook when they are done, when they wake up in the morning. My dad actually did this option for 6 months, 19 years ago, before he had a transplant, so I got to kind of see how that worked. It is a little more compact and a little more high-tech than it was 19 years ago now. I remember him having a huge machine that would sit next to his bed. Nowadays, there's a machine like the size of a nightstand that can sit on top of the nightstand. However, this machine does come with a lot of supplies. You receive boxes of fluid because what happens is you attach yourself to the machine. The machine will move all of the fluid from these bags into the patient's abdomen, and then it kind of sits there, it does its thing, it uses the natural body filtration system within the cavity to kind of filter out the toxins itself. And then after the session, which usually lasts 20 to 30 minutes, then it will drain into a waste bag all of the toxins out of the body. And so this type of dialysis requires a lot of supplies. It also requires a lot of hands-on training that's done in the home, and it also does require a manual training as well. So in case the machine stops working or something like that, the patient is trained on how to do it manually without a machine and just let gravity do its thing to bring in the fluid into the body and then remove it when it's finished. These treatments are done 5 to 6 times a day, but again, I said that they're only 20 to 30 minutes at a time. So it allows for easier mobility and that kind of thing, as far as being able to do it like on a lunch break or something like that, or there is the nighttime option as well while the patient is sleeping. And these supplies can be kind of shipped anywhere. If a patient is traveling or something like that, they just notify the company and they'll send the supplies directly to where the patient is, so it allows for more freedom as far as being able to travel and that kind of thing. So the final option I want to talk about for treatment is transplantation. So kidney transplantation is the most common organ that is transplanted. And there are 2 types. There's deceased donor transplant or living donor transplant. And so I will be sharing a lot more about living donor transplant, as that is the option that I am proceeding with. So future videos will talk a lot about that, but that is essentially receiving a donor or a kidney from a living donor who's graciously willing to share their extra kidney with the patient. So deceased donor kidney donation comes from if a person dies, then one of the organs that is retrieved would be a kidney, and that would go to patients on the waiting list. The waiting list for deceased donor kidneys is over 80,000 patients right now, and so there's a long time that patients need to wait to obtain a donor kidney from a deceased patient. It can be years, depending on the blood type, where they are on the list, that sort of thing. So the living donor option is a faster and actually more beneficial option for patients, just because it has higher survival rates, higher improvement rates as far as being able to find better matches, and just the potential for being able to sustain the new organ for a longer amount of time. So those are the different options for treatment when it comes to end-stage renal disease from polycystic kidney disease. And so now something I'm looking forward to after transplant is being able to actually sleep on my right side more often. So I'm a side sleeper, and I tend to sleep on my left side. However, I do like sleeping on my right side, but the position of my right kidney is kind of a little more, I think, towards the front. And so I can only kind of lay on my right side for a certain amount of time before I feel like a poking. My kidney is getting poked in there, and it's just uncomfortable. So I'm looking forward to kind of having those removed and being able to lay however I want to lay when I sleep. And as far as my travel tip for the day, my tip would be to make sure that you're wearing comfortable clothing while traveling. I think especially for a lot of PKD patients, we start having large kidneys, and it makes the abdomen uncomfortable, especially if it's restricted by tight clothing in the abdomen. So I really tend to wear a lot of loose-fitting clothing around my abdomen just for comfort purposes specifically. And so while traveling, it's really nice to feel most comfortable, especially after a long travel day. So I usually will wear, like a sweatshirt or just something that's loose fitting around the abdomen, because you'll be sitting for a long period of time while flying or driving. So that is my travel tip for the day. Thanks so much for checking out my video. Please feel free to like and subscribe. If you have any questions, leave those in the comment section, and I will see you guys next week. Have a great day.